Welcome back to Jersey Matters. I'm Larry Mendte. We continue our conversation now with Dr. Ray Panettieri, who is the Vice Chancellor at Rutgers University and a Doctor of Pulmonary and Critical Care at Robert Wood Johnson University Hospital. We have moved, as you can see, into the laboratory because Rutgers will be playing maybe a pretty significant role in the research about the coronavirus.
Yep, Larry, we're doing a lot of work right now. We are developing one of the first cohort. A cohort is a group of individuals, healthcare workers, who are going to be in the front line and get exposed to virus. We intend to recruit 500 to 600 individuals who work in the healthcare system and follow them for the next 2.5, 3 months. The question is, what is the denominator of coronavirus infection? We don't know, but we know these individuals as frontline defense will be exposed and will get infected. So we are seeking our colleagues to become actually volunteers and participants in the study, fully recognizing 30 and 40% of them will be infected by virus, but we will follow the course of their illness and hopefully most will be not affected. But we feel this is a wonderful opportunity to answer a fundamental question. What is the impact on those who are taking care of patients with COVID? And NIAID, NIH is very interested in our study, and we look forward to the answers to these questions.
And would the work be done in here?
Some of the work will be done here. We have a very unique model of precision cut lung slices, and those viruses can be added, or attenuated viruses, not active infection viruses, but mimics or mimickers of the virus. That work will be done here and will give us insight into biomarkers as well as new therapeutic approaches.
You said that so quickly, and I think you assumed all of us knew what it was. You said precision lung, what was that?
Yes, so I'm sorry. We have a model where human lungs, we take human lungs, fill them with agar, and then slice them very thin. The size of these lungs are the size of a dime, but as thick as a hair. And we can keep them alive for 2 weeks. That becomes a wonderful model of what a virus would do to the lower parts of your lung. And that is really done here.
So important in the coronavirus because it affects the lungs and that's how people die.
Exactly. We get the virus by inhaling this virus. Now you could get it from skin touching, but the most common cause is from air droplets from cough.
So your hope would be to get lungs that were donated to you from coronavirus victims?
Well, we're not getting the coronavirus lungs. What we want are those that died from catastrophic head or heart injury. These are normal lungs, Larry,
okay,
that we would then infect.
Got it.
To see the consequences of the infection, the shedding of the virus, and whether we have molecules that could block that, which could then become therapeutics.
Are we, I know we've talked about a little bit about the hospital beds in the other room, but you're at a hospital now. How involved is the hospital with the coronavirus, not just in research, but just in what you'll be getting coming to you?
Yeah, we're talking about health services, and I can tell you, Larry, right now, our colleagues, are working 20 hours a day at least, trying to mobilize and deploy people, making sure that we can do everything in our power to treat those who are going to get ill, and we know that's going to happen. There is no fewer than 5, 6 committees across Rutgers, not only taking care of the students, but at RBHS, the Rutgers Biomedical Health Sciences, which has all the healthcare delivery systems. We've mobilized huge committees that every day are figuring out what's our next step. We want to play this chess match and win against coronavirus.
I understand how important committees are, and committees are one thing, but at the hospital, the doctors that are seeing people, are they able to do, are they been so overwhelmed that it affects care of others?
No, right now I think we're in a grace period where we're waiting for the storm. We see the dark clouds coming, so this is the time.
Are you ready for that storm?
We're ready as we ever will be. You know, we see
That's
challenges.
a concern. I can see you. I can see it in your face when you just said that. It's a concern.
Larry, there's concern. There is worries that we're not going to have the beds. The personal protective equipment, PPEs, are in low demand. I mean, we're worried about getting enough masks, enough gloves to meet the challenge. This is horrific if we think in the U.S. not to have enough gloves or masks. But truth be told, it is a crisis.
Do you have enough beds?
Well, you know, we probably need 10 times the beds that we may need. So we're trying to figure out, for example, elective surgeries will likely be canceled. The surgical intensive care units and the ORs themselves will become intensive care units. So we're already have an action plan that we could hopefully mitigate this disaster.
The worrisome thing to me in what you just said is that you didn't say the word may become. You said will become.
Yes, I think the answer is will. And what we anticipate is considerable drain on resources, a considerable fight. This is a crisis in a war. And if we think about other instances where people really hunkered down and contributed, this is the time to act locally, but think globally.
That's perfect. And with that, thank you very much, sir. I really appreciate it. Dr. Ray Panettieri, Vice Chancellor at Rutgers University and Doctor of Pulmonary and Critical Care at Robert Wood Johnson University Hospital. I really appreciate your time. Thank you.
Awesome.
Jersey Matters continues after this.
You wouldn't think the cafeteria would be a scary place.
There are 5.9 million kids in the U.S. living with food allergies.
It happens to me on the school bus.
And a third of kids with food allergies are bullied because of it. Right now, we're working on a cure for food allergies. Until then, there is a cure for food allergy bullying. You. Go to foodallergy.org to teach your kid about the seriousness of food allergies.
If I'm not at school, I can't get bullied.
Food allergy bullying, it's not a joke.